Next on our agenda is Veronica-Donofrio. She is employed at the A.I. DuPont Hospital. Her job there is telephone triage nurse consultant in Kids Health on Call. They cover for over 100 pediatricians in the Jefferson and Lankenau practices in Pennsylvania and the DuPont practices throughout the state of Delaware. Veronica has been doing nursing for a while, not quite as long as some of us. But she, briefly right now, she provides for newborn through 18 years of age when the doctor's offices are closed, assessing patients, triaging level of care, and teaching parents. She also serves a unit representative to shared governance at A.I. DuPont, working towards magnet status. She homeschooled 3 daughters. She's a member of the Delaware Nurses for Life for many years, and has been involved in the conventions that Bess was describing before. And I'll give you Ronnie.
And none of that qualifies me to speak.
You have been volunteered.
Yes, I was invited by Bess, and I thought it was awesome. And then I remembered that I have ADHD. So my talk isn't going to look like Kathy's. It's going to be sort of a circumnavigated kind of thing. You know, the thing is, when you're invited to speak about something, you find out how much you don't know, and it's pretty scary. It's pretty enlightening. I did look at a lot of the statistics, but I don't really have a head for that. I can understand it while somebody's explaining it. I can understand it while I'm asking my husband again, but it doesn't hang in there for me. With the abortion breast cancer link, a lot of the problem happens when you mention it to somebody is that they tell you, well, the studies actually show that that's a myth. It's really not true. And it's not a myth. It is true, and what is so hard to understand is that they make it really very complicated. And it's very simple, what the connection is and why it happens. I'm probably going to talk without the paper because that'll confuse me. Abortion is an interruption in a normal pregnancy. Rarely an abortion is done when actually the mother would have miscarried anyway. But in a chosen abortion, which is called an induced abortion, versus a miscarriage, which is called a spontaneous abortion. It's still called abortion, but it's spontaneous, the body does it. In an induced abortion, there are changes to the development of breast tissue that are interrupted. So when a young girl is born, she already has the very, very beginnings of breast. There are a few little breast cells, they're called type 1 breast cells, under the nipple, that little spot. And some babies, little girl babies, they'll have a little bit of swelling there in their first week or 2, and that goes down as the hormones drop off after delivery. And sometimes a little bit of milk is produced, and most mothers freak out, so they call me up and I try to assure them it's their normal, and they still want to see the doctor tomorrow because, you know, how could I possibly know? And I invite most of them to go see their doctor tomorrow before I even tell them that it's normal. So those are type 1 breast cells, okay? And then when a girl has her first period, which is also called menarche, it's menarche, menarche, which can happen anywhere from age 9 to 15. There are The estrogen and progesterone that are rising up in her body stimulate the growth of more breast cells. Those are predominantly type 1 cells and some type 2s. With the first pregnancy, the estrogen floods the body, which is what supports, develops, and encourages the pregnancy, maintains the pregnancy. The estrogen levels rise 2,000%. Okay? Developing the breast even more. The first sign of pregnancy for many women is tenderness and a little bit of swelling in the breast. So these cells will later become, for breastfeeding, they'll become milk duct. But the type 1 and 2 cells grow and grow and grow. If she has an induced abortion, it's cut. It's cut. The tricky thing is that the type 1 and 2 cells are the ones where the breast cancer begins. As the pregnancy goes on, through the second trimester, the first and second type breast cells continue to multiply. But as she moves into the third trimester, they begin to convert into type 3 and finally type 4, which are the cells that actually contain milk. So as she moves farther into that third trimester, all these type 1 and 2 cells, well, about 85% of them, convert into type 3 and then type 4. Guess what? The type 4 breast cells are cancer resistant. So if that pregnancy had gone all the way to term, that's called an FFTP. That's a first full-term pregnancy. Okay? She becomes protected from cancer. Now, this is tricky socially. The younger you are when you have your first full-term pregnancy, the more protection you have against breast cancer for your whole life. A lot of people don't want their girls having babies when they're 18, 19. But before 24, that is ideal. And actually, if you wait until 30, which for some women even looks young for having a baby, you have created a window, a susceptibility window that's really wide for these type 1 and 2 breast cells to be exposed to carcinogens, one of which is estrogen. This estrogen causes the development of cells. It also causes the differentiation of cells. But it's the promotion of the growth and development where you have an opportunity for a cell to kind of go a little bit off. That's not growing right. It's a mutation. That mutation, depending on the various risk factors, the mutation can be caused by a variety of things, not just estrogen. But it can begin to repeat itself. It replicates because there's been an assault to the DNA. DNA is what causes a repeat of each cell in our body. You know, it's our DNA that makes sure that we keep having blue eyes. You know, all of the cells in our body know, I think even the cells in your feet know that you're supposed to have blue eyes. So they're all over the place. But attacks to the DNA can happen longer when you've got type 1 and 2 breast cells, which are from age 9, perhaps, all the way up to the first full-term pregnancy. So you can have stuff going on. Now, the damage that occurs can take anywhere from 8 to 15 or 20 years to show into a detectable tumor. It takes a really long time for that to grow. Estrogen can make it grow faster. The problem of having an abortion before your first full-term pregnancy now is because you don't have those cancer-resistant cells, and you have an attack of estrogen. Huge amount of estrogen. And then guess what? You had an abortion, so mommy takes you down to the doctor and puts you on oral contraceptives. And guess what they are? Estrogen and progesterone. So those feed is fired. Okay? There are also other risks to the breast cancer, a lot of which happen from social choices, such as drinking. Now, for some women, unfortunately, it's not much of a social choice. They may be alcoholic. So having the alcohol, which can cause mutation in genes, and also because it impairs the liver function. See, this is why it's so complicated. Liver function breaks down one of the byproducts of estrogen. When estrogen breaks down in the body, it leaves metabolites. Okay? They're carcinogenic. But the liver eats up the metabolites. But the alcohol slows down the liver function. Now, it's not an occasional drink. You know, it's not your glass of wine with birthdays or Sunday dinner. But it's a regular exposure. And it's also increased by quantity. Okay. The other exposures, and I don't have any numbers for the impact of cigarettes, and some of the studies say cigarettes don't have an effect. Some of the people who say, who are promoting and teaching the abortion breast cancer link, some say cigarettes are a problem, some say not. But cigarettes have benzopyrene, and that sounds kind of carcinogenic, doesn't it? Okay. So benzopyrene is not a good thing for DNA. And we got all these vulnerable cells there. The type 1 and 2 cells are the ones where the cancer starts. So each pregnancy is growing more type 1 and 2 cells. So you're creating in that susceptibility window before the first full-term pregnancy, if you're fortunate enough to have a first full-term pregnancy. In that susceptibility window, you've got, see, I should have taken 2 full this morning. Okay, where was I going with that susceptibility window? I don't know. So I mean, it's like a lot of information. And I want to tell you that the information it's hard to hang on to. And so much of it has to do with numbers. And I have a younger sister out in California, and that's exactly where she belongs. God bless us. I told her about this talk that I was giving, and it's only recently that I can even tell that, because she was a communist for 20 years. Not only was she sort of left-leaning, she was on the FBI list, okay? So she was big time left-leaning. And, but now she's actually come back to the church, praise God, and he did it. I told her I was giving a talk on the link of abortion to breast cancer, and she said, well, I hope it's going to be a debate format. I said, I don't know enough to have a debate format. And I can't talk anymore, I better go study, but you know, I still don't have enough for a debate format. However, because this is so important, and you know what else? It was hard to read and hard to study because I lost a very good friend to breast cancer just a few years ago. And we lived even close by, so I even, you know, I took a few shifts helping to take care of her, which was really painful. And a couple of blocks away from her, the very same neighborhood, was a very, very dear friend of my daughter, who became pregnant and whose family pushed her into having an abortion.